This podcast is produced by the American Hospital Association. I'm Tom Haederle, senior writer for the American Hospital Association in Washington, D.C., and this is 5 Questions with Priya Bathija, AHA's vice president of one of our flagship programs, the Value Initiative. AHA Today recently caught up with Priya to discuss the first year of the initiative, what resources and learning are planned for 2019, and how its work supports the AHA's advocacy agenda. Priya, the AHA launched the Value Initiative last December. For those that haven't heard of it or are unfamiliar with it, what is the Value Initiative? Why was it launched? And what have been the main focus areas since the announcement?
So the Value Initiative is AHA's opportunity to provide thought leadership to the field on the issue of affordability. It was created really for 3 purposes. First, so that AHA could develop the tools, resources, and education that our member hospitals need to address affordability and promote value within their own communities. It's also an opportunity for AHA to serve as a leader of the national dialogue on affordability in healthcare. We know that others are having conversations around this issue, and we want to be the one that's leading those to make sure that healthcare becomes more affordable for Americans. And third, it's our opportunity to gather the data, stories, and hospital experiences necessary to develop and support federal policy solutions.
You've mentioned data and stories. What other kinds of resources are available to hospitals and health system leaders through the Value Initiative?
Well, we have a variety of resources that we've produced so far through the Value Initiative. One of my favorites is our Members in Action series, which is our opportunity to highlight the work that hospitals and health systems are doing to implement a variety of value-based strategies. Our hope is really that hospitals will look at these Members in Action items, get ideas, take them back to their own facilities, and replicate and scale these programs across the country. We also are releasing issue briefs that provide an overview of the key issues related to affordability, and we have easy-to-use presentations that allow hospitals to start talking about this issue of affordability and value with their employees, trustees, and the community. These presentations include an overview of what is being done on this issue, and it also explains why it's important to consider the full story when you look at value. And that full story includes not only the cost of care, but also patient experience and outcomes. We've also created a lot of tools related to data. Overall, we're evaluating the appropriate metrics that will allow us to track hospital and health system progress on affordability and implementation of value-based strategies. But in the meantime, we've developed things that our hospitals can use as they continue their conversations on affordability and value. For example, we have our affordability data book that sets forth data on national expenditures related to healthcare, as well as perspectives on healthcare from different groups such as consumers, employers, payers, and community partners. And one last resource I'd like to mention is our Voices on Value series. As the hospital field begins to tackle affordability, it's going to be important for us to look outside the hospital field. In some cases, we'll look to other stakeholders in the healthcare community, but it may also be necessary for us to look to other industries to learn what we can do to advance affordable care. So these pieces bring in the perspectives of those outside of healthcare. We're looking at them for guidance and inspiration, as well as their diverse viewpoints on cost, quality, and value.
Speaking of pieces, let me ask you about one more, and that's the component of in-person attendance. So you've hosted some forums, spoken at forums across the country for hospital and health system leaders to attend in person. What advantage is gained by that in-person attendance, hearing you speak?
Yeah, well, we've
face-to-face?
really focused on taking our education on the road. We wanted to meet our members where they are, make it easy for our members to get this education and be part of the dialogue around affordability and value. So one of our events have been the executive forums, which we hosted this year, and they bring together expert thought leaders and healthcare leaders from across the country. It's a combination of guided case studies and panel discussions where these experts can share their strategies and really what their organizations have done to make healthcare more accessible and affordable. The discussion has been important and offers an opportunity for leaders to learn from each other. They can learn what is working and what hasn't worked and what might work in their own communities. We're going to be continuing these events in 2019, and we're really hoping to expand the dialogue at these events to include how hospitals and health systems can work with other stakeholders and how they can create innovative collaborations and novel partnerships to address affordability with others like payers and community partners.
Priya, can you speak for a couple of minutes about how the work of the Value Initiative relates or ties into AHA's advocacy work?
Yeah. Well, I think that the Value Initiative allows AHA to really be a better advocate for our members. So right now, we're working with Congress and the administration on a variety of different ways to make healthcare more affordable. So for example, we've been advocating to protect and expand coverage for all. We continuously advocate to promote high-value care. We look to enhance quality and patient safety, and we advocate to promote regulatory relief. By dedicating resources to the Value Initiative, the AHA is much better positioned to gather the data and stories and hospital experiences necessary to advocate for all of those federal policy solutions. So when you pair the Value Initiative together with our advocacy efforts, we're really working to ensure a policy environment that supports hospital leaders as they take on the issue of affordability.
Why don't we close our 5 questions with a little forecasting, looking ahead to 2019. What do you see as the top priorities for the Value Initiative?
Yeah, well, Tom, I really see 3 priorities. The first is that we're going to continue doing the work that we started in 2018. So we'll continue to be a forum for knowledge exchange and provide AHA members with the tools, resources, and education they need to address this issue. So our members can expect to see more members in action items, more data resources, and more tools that will really expand the conversation on this issue. We're also hoping to create more opportunities for hospitals to collaborate, share best practices, and learn from each other. The second priority is to provide hospitals leaders with tools that will allow them to build a culture of value within their organizations. We all know that culture is a hard thing to change, but to really move the needle on this issue of affordability, or to really reduce cost, improve quality, or enhance the patient experience, each member of a hospital's team needs to be on board, and each member needs to feel that connection to value. So we have a lot of hospitals that have done this well or have succeeded in these efforts, and we're excited to spotlight their work. And the third priority is, as we continue to be the national voice for hospitals and health systems, we want to be an agent of change to foster and facilitate ongoing conversation across all the sectors of healthcare. We want to move outside of just talking amongst hospitals to talk to other stakeholders like payers, employers, consumers, and policymakers. Because really we need to be working together in order to reduce healthcare costs and enhance value.
This has been 5 Questions with Priya Bathija, AHA's Vice President of the Value Initiative. For more information on the Value Initiative, including a number of resources, visit www.aha.org/value-initiative. Thank you for listening.